Prognosis. How will things develop? This is a question we will always have. We want to know what's going to happen next. Will the person make good progress? Are they likely to have a relapse? Let's have a look at what factors determine the improvement in symptoms. There are several risk-reducing and risk-enhancing factors. The risk-enhancing factors are those that make it more likely that a person becomes mentally ill or remains mentally ill. The risk-reducing factors, on the other hand, are those factors that make it more likely that the person will be more stable in mental health and will function better socially. In looking at what factors determine the improvement of symptoms, we need to look at the risk-reducing factors. There are several risk-reducing factors. Let's talk about 10 of them briefly. Number 1, compliance. Complying with prescribed psychiatric medication. Number 2, engagement. Engaging with staff support. Allowing staff to have access. Keeping appointments when they are made. Number 3, support. This is so important. Having support from family or friends. This is a stabilizing factor. Number 4, accommodation. Having somewhere to live that is a stable place of residence. Number 5, insight. A good understanding by the person of the mental illness, understanding what makes it worse and what makes it better. Insight, good insight is a risk-reducing factor. Number 6, abstinence from substance misuse. This includes avoiding the harmful use of alcohol and illicit substances. Number 7, good physical health. This includes eating and sleeping well and treating any known physical illness. Number 8, employment. This may include being in education as a student and both unpaid voluntary work or paid employment. Number 9, the absence of major stresses, for example, financial debt. And number 10, structured daytime activities. This brings stability to the person's daytime routine, and it can also include social and leisure activities. A number of mental illnesses are short-lived, but a number can also run a chronic course. In general, the sooner intervention is sought in the form of professional help, the more likely it is that proper care and treatment is given, with potentially better outcomes. And also, the more risk-reducing factors or stabilizing factors there are, the better the prognosis. The prognosis is usually determined by weighing up the balance between risk-reducing and risk-enhancing factors. It is of note that mental illness is not a life sentence. There is a stereotypical image of a person with mental illness being particularly unable to function. However, there are many people who bypass you on the streets, who attend the same colleges with you, who do transactions with you, or even work with you, who have a mental illness, yet you could never tell because they are stable in their mental state and they're functioning in their day-to-day roles. The likelihood of this happening increases as more stabilizing factors are in place.